Welcome. My name is Alexandra, and I am going to be the moderator for today's webinar. We are going to give everyone until about 3 minutes past the hour to join, and then we will get started. Hello again. For those of you who have just joined, my name is Alexandra, and I am going to be your moderator for today's webinar. We are excited to present to you our webinar, Best Practices Part 3 for the Back Office. We will review best practices for the back office and go over some topics that can assist your practice in improving the bottom line, such as contract management, collections, claim follow-up, and more. We will also talk about the benefits of a communication with your front office and billers and solutions that allow HealthPrime to assist you. Before we get started, there are a few housekeeping items to go over. Questions you have for us are addressed via chat message using the Q&A button at the bottom of the screen. The questions you submit throughout the presentation will be addressed at the end of the presentation. Questions we have for you are addressed using polls. A poll will be conducted before and after the presentation. We encourage you to participate so that we can focus on areas of interest. Before introducing you to Caroline Balestra, I'm going to go ahead and launch the first set of poll questions. Thank you for participating. Caroline Balestra will be the presenter today. Caroline has 8 years of experience as a practice administrator and 13 additional years focused on revenue cycle management and analysis. She currently works as a business process analyst at HealthPrime, where she coaches team members and clients on best practices, coding, and practice optimization. Without further ado, I am going to turn it over to Caroline for the presentation.
Thanks, Alex. Welcome, everybody. Today is the conclusion to our best practice series. This is part 3 for the back office. So today, the topics we'll cover include managing payer contracts for optimal reimbursement, your accounts receivable and collections process, denial and claim follow-up, how to bridge the gap between front and back office, reporting for success with all your changes, and lastly, we'll talk about the benefits of a partnership to get help with some of these duties. Much of these you may already know, and that's okay. Sometimes reminders can be beneficial in multiple ways. Let's go ahead and get started. The back office is the part of the medical office that is made up of administration and support personnel who are not usually as client-facing as the front desk staff. Back-end staff often deal with many different payers and their guidelines, which makes the upfront verification even more critical. Any incorrect data on claims will result in denials and/or rejections, which makes their job more difficult. We all know that before the patient visit, we need to be verifying eligibility and benefits, understanding claims address or payer ID to route claims correctly, and also patient responsibility for the visit. But communication with the back office is critical because without their input, you could have many claims and their payers refusing to ever pay a claim due to a network status or a CPT not on the fee schedule, for example. I still feel that the number one reason for denials that I see on a daily basis results from invalid data collected up in the front office. One of the primary tasks for back office personnel is to properly manage the practices and providers' payer contracts, as well as monitor payer reimbursement accuracy and billing performance. While HealthPrime can assist with much of this responsibility, there are some things that your back office biller will still need to do regularly. Communication with your biller and/or billing team should be exceptional where payer contract management is concerned. The back office must communicate any denial and rejection trends to the front desk and management to help put processes in place that stop or reduce any trending issues. Helping the front office understand any payer-specific guidelines and payer benefit requirements that they need to be aware of when booking patients can help dramatically increase reimbursements. For example, understanding that a specific payer only allows 5 visits per year and that the patient has used them all is vital in collecting payment in full for the 6th visit upfront, or if a visit requires auth for a specific service or provider. Understanding these types of denials from back office staff, for example, can allow you to reschedule that appointment until the authorization has been attained. This helps avoid a denial for any missing or invalid authorization. These are just a couple of examples, but there are many ways that the back office can help the front desk. Another way is by providing previous or outstanding balances for all patients on the schedule for the day prior to that day's appointment, so that the staff who are confirming your appointments can prepare patients to bring payment with them when they arrive. There are many ways that payer contract management can assist with maximizing your revenue. It's a very crucial back-end function, in my opinion. I recommend that your team always takes time to assess payer performance and payment accuracy, as it can help organizations to negotiate better reimbursement rates and improve medical billing compliance overall. It's important for back office personnel to communicate the network status with the front desk and each of your providers for that matter. Not doing this could mean that maybe an in-network payment was collected versus a larger out-of-network deductible payment, for example. Chasing that patient for payment is much harder after they've already received the service. These back office personnel are usually the individuals that are responsible for negotiating fee schedules with your contracted payers. Understanding how to work with payers to get CPT codes added to your fee schedule or allowable reimbursement amounts increased on those fee schedules is key to best practices where contracts are concerned. Some practices often employ several staff members to flag charge capture issues and rework the charges. However, using a system that trends charge capture data may improve back-end revenue cycle processes. Your HealthPrime optimization team can also report on such trends, not only with charge capture, but also with rejections and denials. Being able to trend the data and have a conversation with staff or clinical teams and providers can prove helpful in preventing issues going forward. Ultimately, like I previously mentioned, back-end staff can be in charge of managing a wide range of payers. The complex web of different payer requirements can make claim submission a challenge. There are, however, some ways for us to prevent claim issues resulting in rejections, denials, appeals, and recoupments or non-payment altogether. As we talked about in part 2, pre-billing verification and check-in has everything to do with this. But after the patient's visit, the back office can assist in getting claims paid as well. Of course, clean claims are ideal, but claims should be scrubbed prior to submission to help prevent rejections and denials. Back office staff should verify clinical documentation, charge capture accuracy, ensure patient and health insurance information is correct, and check that appropriate codes and modifiers are present. Our HealthPrime RCM does complete a high-level claim scrub as part of the charge review process that we put encounters through for you once you've submitted your charges to us. Inevitably, a share of claims will be returned to the back-end staff as rejections or denials. This happens no matter how clean a claim may be or how much we scrub for errors. We find that many payers tend to discover any reason possible to reject or deny a claim, and it's not something that can be caught by back office or billing staff no matter what's done. It's recommended and very important that all rejections and denials are always promptly reviewed and reworked to get the claim processed properly and recoup reimbursement to avoid unnecessary delays. About 90% of claim denials are preventable, but as I talked about, denials will still occur. The majority of these denials can, however, be corrected for payment. It's sad to say that per recent surveys, AMA reports that over 1/2 of claim denials are never resubmitted to the payer. This is where your billing staff or outsourced billing company can help you. For example, we here at HealthPrime have teams of staff skilled in working denials and rejections to ensure proper corrections are obtained, claims are worked promptly, and then resubmitted to payers for payment. It should be standard procedure for your team to work on denied claims every single day. Just because a claim was denied once does not mean it will be permanently denied. Your billing team or back office staff should be steadily working, sometimes in conjunction with your front office and even providers, to make the necessary claim adjustments or corrections to capture reimbursement. It takes great attention to details and perseverance. For claims that qualify for reimbursement, back-end staff should ensure that payers pay correctly. They should pay your organization according to the contracts that are in effect. Once claims are adjudicated, any remaining balance on a patient account should be billed immediately by generating either an electronic notice or paper statement, sometimes both, to the patient. Staff will need to work with patients to collect the full financial responsibility if not collected at the time of service by your front desk. Back-end patient collections can be a major challenge for some provider offices. Not only do practices only expect to collect between 50 to 70% of a patient's balance after a visit, but about 70% of practices also state that it takes at least a month or more to receive payments from their patients after the service has been rendered, if they receive payment at all. We all know that with growing deductibles and coinsurance, patient responsibilities are increasing, making it all the more difficult to get the payment at the time the patient is seen, making it all the more important, to get the payment at the time that the patient is seen. Providers can improve patient collections by offering electronic payment options through their patient portals or medical practice management software. Many patients with the option to pay electronically find it more convenient and secure rather than mailing credit card information or a paper check, and would rather satisfy the bill in this manner. As back-end staff collect payments from payers and patients, they complete the healthcare revenue cycle by posting payments to the patient case and closing patient accounts. The front and back-end staff handle very different parts of the revenue cycle management. Breaking down the silos between the two components can improve an organization's financial performance. There are some common mistakes that can lead to denied claims. Some of these consist of CPTs or HCPCS codes that do not have specific enough ICD-10s attached to them, or the claim is missing some other sort of additional information. Maybe the charges were not submitted on time, or there was incorrect patient identifier information, which can relate to eligibility and benefit issues. Some may be for coding, such as when a service is missing a modifier, or maybe has an invalid place of service code. If you've been doing this for a while, like I have, then you know that denials will always happen no matter how careful and thorough you are. A fair share of submitted claims get denied no matter how much scrubbing and preparation goes into the process. Let's face it. If insurance companies were in the habit of paying everything we sent to them, then billers and back office personnel would likely not be in business. We all know that insurance companies drag things out, and many times they make mistakes as well. Some of the best practices in working with insurance denials are first to quantify denials. You can't manage what you cannot measure. So first order of business is to develop a solid denial management process. You need to understand the volume of each of your denials, the root cause of each, and what the payer might possibly pay, so that effective corrections can be made and refiled promptly for your claims. Your account manager or operations consultant at HealthPrime can work with you on which of the most recommended reports can be used to help you in identifying and quantifying controllable denials, so that a plan can be developed to address any trends or issues that are found. Next, ensure that all denials, including $0 EOBs, are posted. Posting of zero pays will allow for better reporting and therefore better denial management. Being able to quickly identify non-paid or $0 EOB denials can help team members report on and quickly correct any issues, which in turn will allow for quicker turnaround times to work such types of denials. Lastly, keep a rules document for any billing rules you need to know about. For example, a cheat sheet of which CPT codes for telehealth require a modifier for United Healthcare, or which place of service code should be used for Medicare telehealth for your physicians. This way, your entire billing team will function as one, kind of like a finely tuned machine. So if you work with HealthPrime already, you know that each account has a practice-specific billing rules document. It's recommended that every practice has a similar type of document. These practice billing rules can and should be periodically updated to help avoid denials, correct denial trends, document payer-specific guidelines for coding, when to list a supervisor physician on a claim, and more. Every EOB or ERA contains codes that tell you why they made the decisions they made on your claim. These are called CARCs and RARCs. A CARC is a claim adjustment reason code, and a RARC is a remittance advice remark code. Claim adjustment reason codes communicate an adjustment, meaning that they must communicate why a claim or service line was paid differently than it was billed. If there is no adjustment to a claim or line item, then there's no adjustment reason code. Remittance advice remark codes are used to convey information about remittance processing or to provide a supplemental explanation for an adjustment already described by a CARC, or claim adjustment reason code. Each remittance advice remark code identifies a specific message. Again, these codes are found on ERA files and EOB documents and are extremely helpful when working, posting, or reworking your claim denial or adjusted line item. There are some great tools that can be found online, such as the X12 remittance remark codes list, which provides CARCs and RARCs that most payers utilize. I have this link for you in my resource page at the end of this presentation. Most all primary new claims today are filed electronically, but in addition to those, payers will also accept most corrected claims and secondary claims electronically. This makes resubmission to get a corrected claim on file much more timely. To submit a replacement claim, corrected claim, or void a claim, you must ensure that the proper boxes are updated so that the resubmitted claim is complete and that it is clearly identified as such by marking it as a replacement or voided claim for the payer to process for payment. Unless the codes on your initial EOB indicate that you cannot resubmit a correction, your resubmitted claim must contain a resubmission code in box 22. This code tells the payer that the claim is, in fact, a replacement claim or a voided claim, depending on the code used. Additionally, when submitting a corrected claim or replacement claim, you must use the original claim number so that the payer knows which claim to replace or void out of their system. Remember, corrected claims should be sent with all line items filled out for that claim, and they should never be filed with just the line items that need to be corrected. So let's chat a little bit about appeals. We all want to get claims paid before they ever get to the appeal stage, but sometimes it does come to this. Anytime your claim requires a first or second level appeal, it's important to understand when it should occur. Once you have determined an appeal can be submitted, ensure you are within the timely filing deadlines for such an appeal. Many payers will give you a deadline from the denied date to do this, so it's important to pay close attention to those dates, or just ask the payer if unsure. Filing an appeal for a claim that is not appealable or requires a fresh claim will go nowhere ultimately, and is a waste of time and energy. When you do submit an appeal for a claim, you must use the proper form for reconsideration where applicable, and when sending an appeal letter, it's important to use proper and effective language in those appeals. Once your appeal has been submitted, it's really important to follow and track those appeals through to a decision. HealthPrime does perform such appeal tasks for you. We have multiple tools at our disposal to ensure we have all of the correct forms, letter verbiage, and so forth. We understand that timely and appropriate follow-up is key to resolution and payment of the claim. We will work all claims until efforts have been exhausted or payment is made. Nothing is more gratifying than getting a hard denial overturned and paid. Some denials require perseverance, tenacity, and patience, and can take months to resolve with lots of back and forth with the payer. Take a moment to celebrate these successes when they do occur. It's important for managers and practice administrators to acknowledge any gaps and work to bridge these in your team communications. A lack of communication between front office staff and back office staff leads to an ever-widening gap for many independent small practices unless it's addressed appropriately. These gaps often cause frustration and misunderstanding among employees that can unfortunately trickle down into patient care. To ensure long-term viability and sustainability, you must address the chasm among staff members to improve the practice's efficiency, revenue, patient satisfaction, and more. Some tips to bridging the gaps between front and back office includes developing procedures and policies that support collaborative workflows. Examples of this are to maybe create checklists and protocols for the front office staff in order to assist them in collecting all of the information that coders and billers need to submit clean claims. Efficiency here will begin closing such gaps. Another example is to create a denial management policy that requires coders and billers to inform you or your front desk staff of common denials or rejections and talk about how to avoid them. Setting clear role-specific responsibilities are critical in setting clear expectations to help employees with the important roles they play in supporting the overall efficiency. Supporting communication by scheduling daily briefings for the beginning of the day. Try a morning huddle to go over the day's appointments, reminders for data collection, such as updated addresses or phone numbers and email addresses. By fostering collaboration among front and back-end staff, revenue cycle management becomes a much smoother process, and collections can increase on average by approximately 300%, believe it or not. Ensure your staff are cross-trained. Cross-training employees to perform multiple roles within the office not only keeps the practice running smoothly, it helps improve the patient experience and reduces staff burnout. Cross-training is also about developing employees to improve the business and the customer experience. It allows employees to expand their skills and knowledge on a specific job because they get the ability to be included in and work on new projects, helping them to gain the skills necessary for specialization or a more senior role. There are some key benefits besides what I've already mentioned. These are increasing your return on investment, improved employee motivation, and increased workforce sustainability, just to mention a few. Team building with your staff can be invaluable. Team building games give employees the opportunity to get to know each other, as well as share more about themselves. Not to mention that effective teamwork is essential as it minimizes adverse events caused by miscommunication and misunderstandings of roles and responsibilities. Team building has multiple benefits. It improves productivity, encourages collaboration, and builds trust and respect among employees. Team building helps individuals work as a cohesive group where all members feel invested in the direction and accomplishments of the team. With effective team building, you'll end up with a group of people organized to work together to meet the needs of their patients by regularly aligning and accomplishing their purpose and goals in your practice. Some ideas to building a strong team include a focus on setting goals, valuing each individual role that the team member plays in the practice, celebrating successes and failures, knowing each other, and always demonstrating transparency when possible and with all team members to encourage clear communication. So let's see. Now, in order to ensure all the changes you have made to improve upon your front and back office for the overall practice, you'll need to have the ability to run reports that help you to identify if the changes implemented are having an effect on claims, patient AR, staff communication, et cetera, et cetera. Are your improvements actually working, or do they need even more improvement? Our HealthPrime Datalytics practice optimization tool can be used to help you in measuring your successes with any recent workflow changes within the office. Using this tool, you can view a number of different metrics at a high level and then dig as deep as you need to into each area that helps you to identify where your specific focus might need to be. Here, I'm showing an example of the Datalytics demo account dashboard. I highlighted one report here where you can easily measure claim acceptance at the clearinghouse. This can give you a clear picture of the rejection rates and reasons behind those rejected claims. The data in this tool is pulled directly from your practice management database and organized in a way that supports your practice's reporting needs, whatever they may be. So there are so many reports in this tool that I find extremely helpful. Another couple of reports I'd like to point out that can be helpful in measuring your success and changes made to your office are, let's see, the next report I'd like to point out is the collection percent, which is your net collection rate. Here, the NCR is listed as 96.5. Please keep in mind this is a demo analysis and not based on real account data. Hopefully it's better than that. This also shows you, as you can see, where it says 45%, the percentage change since the last year. In small writing underneath it, it shows 45% higher than the previous year. We also have an AR management report where you can measure the days in AR. This number reflects the number of days it takes a practice to collect payment due. The lower the number, the faster the practice is at obtaining payment on average. The HealthPrime goal is 22 days or less, but if your range is between 22 and 28 days, you're in a good place. Now, if your days in AR are more than 28 days, I'd recommend a deeper dive. Something could be causing delays in reimbursement. And in order to address any issue, you first need to identify that root cause and which payer or payers are driving these higher numbers. So you can also measure charge acceptance, which is indicative of denied claims. If you drill in here, you can review controllable versus non-controllable denials each month. This reflects in this demo that 95.2% of charges are accepted for adjudication, and those are not denied. No show rate, if reported by your system, allows you to monitor any scheduling changes that you've made. There are other reports on the HealthPrime Datalytics dashboard that you can utilize. I just wanted to give you a couple of examples. Feel free always to visit our website to view the Datalytics overview to see everything this tool offers. Or if you're already working with HealthPrime, please just ask your operations consultant or account manager for any assistance with reporting that you need. If you don't use the Datalytics tool, you can still run similar reports in whatever system you're using. I recommend doing this periodically to capture progress on any internal workflow change that you've made. Ultimately, we want to help you be the most efficient and streamlined practice you can be, where your employees enjoy working and patients like to visit. The healthcare revenue cycle is a complex process of managing revenue as it flows through an organization. Reimbursement and patient payments touch a myriad of departments. Therefore, revenue cycle staff from the front and back ends should partner and constantly communicate to ensure revenue flows smoothly. Here at HealthPrime, we offer partnerships with your practice to optimize your revenue. We have practice optimization tools like HealthPrime Datalytics that we just showed you to help support your business grow and succeed. HealthPrime has a proven track record of increasing the average percentage of claims paid after first submission, reduce controllable denial rates, improve net revenue to the practice, higher percentages of clean claims, reduced outstanding AR over 120 days, and not only fewer lost claims, but faster claim payment. We now also offer virtual office solutions to help your practice where you need focused help the most. If you're struggling with coding, for example, we employ a team of certified coders that work with many different specialties. Or maybe you're short-staffed in the front desk and need someone to verify benefits and eligibility, or obtain authorizations, make scheduling calls, or recalls to fill your schedule. Well, we can help. If you already work with HealthPrime, talk to your operations consultant today about getting the help you need. And again, if you're interested in learning more about our billing services, optimization tools, or add-on solutions, you can reach out via our website or by email at businessdevelopment@hpiinc.com. So here are the couple resources for your remittance claim submission, and I also provided the website address for you. And that's it for today. Thanks so much for joining me in the conclusion of our Best Practice series. I hope that you found something helpful in this series and that your team members take something away from this. Please reach out to us at HealthPrime for any of your practice needs. We're here to help. Okay, I'm going to turn this back over to Alexandra to close us out with some questions if we have them. Thank you.
Thank you, Caroline. We do have a few questions. The first one is, what basic reports would you use to measure whether our contracted rates are being paid in full or underpaid?
Oh, okay. So each system, they differ in what they call their reports, but you're looking for something that gives you the CPT code that was billed, the name of the payer, the expected allowance amount, and total paid. In Careo Practice Management, for example, there are a couple of reports that can be used to identify underpaying contracts. The first is Contract Management Summary, and then you drill into that using the Contract Management Detail. So you can view each charge, the actual allowed amount, and the actual payment. If you have fee schedules loaded for each payer, you should be able to also get the expected payment to populate. This way you can compare very easily to identify underpaying entities. Remember that these reports in Careo, the example that I used, don't separate patient payments from insurance payments. It will only show the total paid. It just includes both.
Thank you. The next question is, what is the best way that you know to sort denials? so they are worked properly and missed revenue is reduced as much as possible?
Well, I recommend that you get familiar with reporting in whichever system you use, or at least know what you want to see so you can ask for help from your billing team or your software vendor. I would want to see all top dollar denials, which means those bigger reimbursed CPTs at the top of my list, along with the oldest. So I can work to avoid timely filing or missing any denial reconsideration deadlines with the payer. Then I would want to group each by payer so I can work each payer at a time. Hopefully, I could squash each group of claims with one call or one portal login for the payer. If you have many for one payer and find they are all denied for the same reason or incorrectly denied due to an example like auth is not on file or invalid, but you did get the authorization, you might check with the payer or provider relations manager for that particular payer to determine if you can submit a project to get all claims reprocessed at once. Creating a system, whatever that might be, for how you work them is key to succeeding in getting the claims reworked timely and paid.
Okay, thank you, Caroline. And thank you everyone for joining our webinar today. The recording of the webinar will be uploaded to our website tomorrow. You can also find it on our YouTube channel. For more information, you can email us at marketing@hpiinc.com or visit us at hpiinc.com. Thank you and have a nice day.